be aware that this podcast discusses personal experiences of self-harm and suicide.
I would say being aware of issues and societal pressures which young people are currently facing, because these change all the time. And the way we communicate, the way we socialize, the way we move around is all rapidly changing all the time. And I think mental health professionals need to be aware of that, because a lot of these pressures have been recently introduced, particularly through social media. Had a lot of friends struggling with body dysmorphia and eating disorders, and that's been triggered a lot by social media and societal pressure to look perfect. So those perfections within online, the merging of online and physical space, and having understandings of how the digital is definitely enhancing and making students more vulnerable, but also understanding that accessing mental health services isn't as easy as it should be in terms of going to the GP. Actually getting a GP appointment post-COVID is incredibly difficult. And a lot of people have actually given up trying to go to the GP to get a referral letter, to go to a service which could support them, because they don't have the time to wait. They don't have the time to sit down and ring up the GP practice, continuously asking for an appointment. They don't, or filling out all the forms for mental health services in universities. I think it's really hard to get through those gates. It's as if it's like the floodgates are shut. And as soon as they open, people flood through them. And if the service was made more accessible, the level of flood on the other side of the floodgate will be far lower than the current situation we're in at the moment, whereby having to wait for an appointment takes up to a year because of prior accessibility issues. Offering online support for CAMH by CAMH professionals, on like even just a web chat, which aren't actually registered patients, just to have a conversation with somebody to get them known in the system would save people's lives.